Hello everybody, this is Dr. Shruti Devi, Fellow in Gynaecology Oncology, Narayana Health City, Bangalore. So ovarian cancer is one of the important cancers because it causes significant morbidity and mortality of women all around the world. And unfortunately we see that the incidence is on a rise in the recent years. And in India, it's seen that it's the third most common cancers in the women. And so to know a lot about that, here we have Dr. Rohit Ranade, consultant gynae oncologist in Narayana Health City, Bangalore.
Hello, Shruti.
Hello, sir.
Yeah.
So how severe is this problem in the world and in India?
Yeah, as you have already said, it's one of the common cancers in women in the world as well as in India. The statistics for cancer is usually given by an organization called WHO, which prescribes statistics known as Globocan statistics. And if you look at statistics, it is the third most common cancer in women in India, with about 36,000 to 37,000 new cases a year, which is quite significant. And over the world, we get about 3 lakh new cases every year of ovarian cancer.
Okay.
So that is a quite significant amount.
Okay. So why will a lady get ovarian cancer? So what are the causes?
Yes. So if you ask me a single cause, there is no single cause for it. There are multiple of causes. Like for example, if you look at cancer, there are few cancers where we know what causes are there. Like for example, smoking causes lung cancer is something which we definitely know. Tobacco chewing causes oral cancer, that is something which we know. Cervical cancer is caused because of a human papilloma virus, that is which we know. But ovarian cancer per se, there is not a single cause. But there are multiple causes which we think might be reasons. Like for example, something related to genetics, it can run in families, or it can be some mutations occurring which are non-genetic, or exposure to toxins can be a cause. Increasing air pollution could be one cause, or a state where the amount of estrogen in the body is more, something called as hyperestrogenism, that could be one cause. Also other contributory factors like hypertension, obesity, that is people are getting more and more fat, and hypertension could be contributory factors.
So are certain women under more risk to get ovarian malignancy?
Yes. So as I said, lady who is more exposed to estrogen, so somebody who is taking hormonal tablets, could be at the more risk of ovarian cancer. Then somebody who's basically taken treatment for infertility. So infertility treatment is usually associated with a lot of hormonal tablets and a lot of injections. That could be one reason. Again, obesity is one reason, which could be late marriage is something which is known as a risk factor. And also, as I told you, about 18 to 20% of cancers are hereditary. That is, they go from generations to one another. It is primarily because of a mutation in a gene which we know as a BRCA gene. So that is one important subset, about 18 to 20% in India.
Okay. So how will a lady come to know that she's having a malignancy? Are there any symptoms that?
Yes. So again, that is which is sort of a little bit unfortunate event for ovarian cancer is the symptoms are all non-specific. You might have just pain in abdomen, or you might have swelling of the abdomen or bloating of the abdomen, or you will just find that I just have reduced appetite. I'm not just able to eat anything. That could be one reason. Sometimes if you especially have a huge tumor in the abdomen, the tumor can press on the bladder, and so you can have a feeling that you have to go to the washroom quickly or frequent times. Also same is you are not able to pass your motions that well, and you always feel that your rectum is not getting emptied. So even if you pass motions, you're feeling that fullness again. So fullness is again something which is a symptom. So all of this are like pretty sometimes they can present with indigestion also.
Okay. So when a patient comes with the symptoms you told now.
Yes.
So
another important point I forgot to tell you. Also, some people come to our clinic with a previous history of ovarian cyst. Okay. Now, if somebody hasn't had an ovarian cyst previously, there is a particular percentage that it can turn into a malignant. So that is also one risk factor which I forgot to tell you.
Okay. So when a patient comes to you with the symptoms you told now,
yes.
So what are the initial tests you will advise the woman, sir?
Yes. So if somebody has symptoms, like the initial test that we do is an ultrasound screening ultrasound test, which is readily available everywhere. It's a cheap test, and as I said, it's readily available. Now, depending on the ultrasound report, if there are some features which might tell us that it is malignant or cancerous, then one can go in for specialized investigations as a CT scan or an MRI scan, depending on your availability. One more, also your oncologist, it's always important to consult an oncologist, preferably a gynec oncosurgeon or at least an oncology hospital. Depending on your doctor, you might be advised to do an MRI or a CT scan, and a particular test called as a tumor marker test, which is known as a CA-125 or the test. In addition to that, obviously, a good examination is also, which is important.
Okay, sir. So we know that there are some screening programs for cervical cancer and breast cancer. Is there anything like that in?
Yeah, this is also one thing which is really unfortunate, that as compared to a breast cancer where we have a mammogram, or for a cervical cancer where we have tests like pap smear or HPV DNA, there is no screening test which is available for an ovarian cancer. Though some people advocate that you do a yearly ultrasound scan or a CA-125, but none of them has shown that to actually improve survival. Okay. So, but my advice is those who are affording should at least get an ultrasound scan once a year. Is something which can be advocated, but again, it is not a screening strategy.
So can you elaborate us more on the staging of ovarian?
Yeah, so as every cancer, ovarian cancer also has 4 stages. Primarily, when the tumor is just limited to the ovaries, that is stage 1. When it spreads into the other pelvic organs like the uterus or the fallopian tube, that is the stage 2. Stage 3 is when it spreads, when the spread is limited to the abdominal cavity, like the omentum or the peritoneal lining or something. That is stage 3. And stage 4 is obviously when it spreads to other organs like lungs, liver, or into the chest. That is called as stage 4.
Okay. So what are the various treatment options available, sir?
Yeah. So primarily, as we discussed, the diagnosis is most important. That mainly, if you look at cancer treatment, there are 3 treatment modalities. One is surgery, second is radiation, third is chemotherapy. Now, radiation is not a good tool for ovarian cancer. Okay. So primarily, the treatment options are surgery and chemotherapy. Now, surgery is the most important, you can say, the backbone of the treatment for ovarian cancer. A well done surgery is something which is very important. Preferably, it should be done at a dedicated oncology center. It requires a team of good qualified and skilled surgeons, because you need to be able to remove the entire disease. So which is something which in medical terms is called as gross macroscopic resection. So you don't need to leave any disease in the abdomen as far as possible. And you also need a good team of intensivists to take care of you in the post-operative period, because the surgery is going to last for 5-6 hours. And after you recover, the other modality of treatment is chemotherapy. Now, that will depend on your histopathology report. All the specimens that we are removing, they will send it for a detailed pathological evaluation. And depending on that, then you could be given chemotherapy as well. Now, in certain, this is mainly done for early stage cancers and some of the advanced cancers. Now, in some of the advanced cancers, we give something called as chemotherapy first. So chemotherapy is given first. The aim is to just reduce the disease, and we term it as neoadjuvant chemotherapy. Once the disease is reduced, then we go in for surgery. Okay. So it's always a combination of both of them. You either do, in some situations, you either do surgery first followed by chemotherapy. In certain situations, you do chemotherapy first followed by surgery.
Okay. So are there any new treatments, any recent advances in the treatment of ovarian
cancer?
Yes,
as our research is increasing and science is developing, we have few newer modalities. If you look at it, ovarian cancer and breast cancer are 2 cancers where there is tremendous research going on, and there is people are trying to find newer cures and newer regimens, newer treatment options for that. So among the newer treatment options, one is something called as HIPEC, or it is known as hyperthermic intraperitoneal chemotherapy. Okay. So now this treatment is, you do a surgery, you do a proper surgery, you remove all the disease. In addition to that, you remove the total peritoneal lining of the patient's abdomen, And after you achieve all of this, that is, you are able to remove all the disease, you put chemotherapy inside the abdomen. So you give chemotherapy exactly at the place where it will act. And this is given at a higher temperature of 41 degrees centigrade and at a higher pressure of nearly 1000 RPMs for about 1 hour to 2 hours, depending on the regimen that you are using. So this is one newer modality of treatment which is available. In addition to that, there is something called as a targeted chemotherapy. Now, if you look at general chemotherapy, there are some drugs which are general chemotherapy. That is, they will act on all the cells of the body. There is some specific targeted therapy that the cell will act on a particular cancer cell only. So such type of targeted therapies are also being developed for ovarian cancer. Some of them have been quite successful. So this is something which is another new modality. Another modality which is as of now it is still in the research, or you can say in the trial setting, is immunotherapy. So there are certain drugs which will improve your immune system, or which will sort of modulate your immune system so that it will act and kill the cancer cells.
Okay. So when a patient comes to you in advanced stage, are there
Yes.
any chances of cure for her?
Yes, definitely. This is one of the cancers where even stage 4 patients are treated with curative intent. Now in cancer there are two intents, one is curative intent and one is palliative intent. Now palliative is something where you are not looking at cure, but ovarian cancer, because it is a very chemosensitive cancer, it is one of the cancers where even in stage 4 we look at cure options.
And sir, I just wanted to ask you something. So in this recent times of this COVID pandemic, if a patient has the symptoms you mentioned before, or if they're already under treatment, what do you want to tell them?
Okay. So per se, this COVID-19 crisis has affected not only our patients but also the entire healthcare, and also somebody who might be suffering from these cancers. So per se, if you look at death rates from cancer versus COVID-19, the death rates from cancer are much more as compared to COVID-19. Now my advice is, if somebody has these type of symptoms, they should not delay seeking advice from a doctor. And so that because the more they wait, the more there is a chance that their cancer is going to progress, and this is going to reduce the survival. Another advice to patients is those who are on treatment should consult their oncologist, and they should not delay their treatment as much as possible, primarily because there is a chance that it can spread. The cancer can spread. Okay. So these are some only thing is that general precautions they have to take care. Like patients who are on chemotherapy should not go out. They should try to avoid contact as far as possible, and even post-surgical patients, they should follow social distancing and isolate them as far as possible, because after surgery their immunity is going to be on the lower side, and this is going to increase their chances of infection. These are some precautions which they have to take, but they should not deny themselves the treatment.
Okay. Thank you so much, sir.
Thank you.
Hope you found it useful.